Sickle cell disease affects millions of people worldwide. Today, we're joined by Dr. Stephanie Guarino, clinical lead for the Sickle Cell Program at ChristianaCare Center for Special Healthcare Needs. She's here to discuss sickle cell disease and the treatments available here at ChristianaCare. Dr. Guarino, thank you so much for being here. Please take a minute to introduce yourself.
Sure. Thank you so much for having me. I'm excited to share about sickle cell and what we're doing at the program. So I am a hematologist who is the medical director of the Adult Comprehensive Care Program at the Center for Special Healthcare Needs.
Fantastic. And for those who may be unfamiliar with sickle cell disease, how would you define it?
Great question. So sickle cell disease is the most common inherited red blood cell disorder. So usually red blood cells take oxygen to all parts of your body. And what happens in sickle cell disease is there's one genetic mutation that makes them stiff. So instead of being round and smooth like a donut, red blood cells become stiff, kind of like a banana, blocks blood flow and causes lots of complications over someone's life.
And how does that impact the body?
Yeah, it's a great question. So sickle cell disease is different for everybody. Everyone experiences different complications, but in general, patients can have pain. It's called a vaso-occlusive crisis that can happen anytime in any part of the body. Patients also experience strokes or heart disease, leg ulcers, acute chest, which is a complication in the lungs. Because your blood flows everywhere in your body, really any organ system or any part can have complications from sickle cell disease.
So you mentioned pain, but how is someone diagnosed with sickle cell? What are the symptoms?
So what's nice these days is that sickle cell disease is included in the newborn screening program in all states in the country. And so when babies get those blood drops from the heel stick when they're born, sickle cell disease is one of the things that we screen for. And that's important because patients with sickle cell disease need to get treatment from the time they're born to prevent infections, which were a major cause of death prior to treatment. And so for patients who may be a little bit older, who may not have been screened for sickle cell disease when they were born, one of the ways that we suspect it is with certain findings on blood tests. So anemia or low hemoglobin test, along with you can actually see sickled cells under the microscope when you look at a slide. So it's pretty easy to see those cells and make the diagnosis.
So if someone is watching and is an older adult who maybe wasn't diagnosed but has been living this life with pain, how would they go about getting diagnosed now?
The best way to confirm a diagnosis of sickle cell disease is with a blood count and a slide that your hematologist or blood doctor can look at under the microscope, and with a test called a hemoglobin electrophoresis. That just sorts out which specific types of hemoglobin building blocks someone has and is able to diagnose not just sickle cell, but a lot of other problems that people may have with their red blood cells.
And if someone's living with sickle cell disease, are there lifestyle changes that they can do to for a better quality of life?
So what we like to focus on non-pharmacologic management of sickle cell disease at our program. And that means ways to manage sickle cell disease without medications, because that's very important to a lot of our patients. And so one of the things that we talk about a lot is staying hydrated. It's incredibly important for patients with sickle cell disease to stay hydrated, even in cold weather, to avoid extreme temperatures. So a lot of patients have problems when the weather starts to change, when it's 80 one day and raining the next. All of those things can precipitate or cause pain crises and other complications in patients. And one of the areas that we're just starting to learn more about and really starting to investigate at our center and others is the role that nutrition plays in patients with sickle cell disease in managing their complications. And then last but not least, we always encourage exercise, moving your body in ways that avoid overexertion can be helpful in managing complications of sickle cell.
So you mentioned your program specifically really encourages that non-medical treatment, but what are the medical treatments like at the Center for Special Healthcare Needs?
So for a long time, we didn't have any ways to prevent the complications of sickle cell disease. We were forced to respond to them once they already happened, which is not ideal at all. We had a medicine called hydroxyurea, which is a medicine that patients take by mouth that can prevent some of the complications of sickle cell disease. But that medicine doesn't work for everybody and does have some side effects. And so for a long time, we didn't have many other options. But just in the last few years, there's really been growth in this area. And so we're able to offer 3 new medications to prevent some of the complications of sickle cell disease. Some of them are oral, some of them are given as infusions on a regular basis. But what's exciting is that they all can prevent some of the pain crises with sickle cell and some of the other complications that we've talked about. And what's next on the horizon that we're so excited for is actually a cure for sickle cell disease. So things like bone marrow transplant and gene therapy are still being evaluated, and we're excited to bring those to our patients in the future. But that's the ultimate goal, is a cure for sickle cell disease,
which is incredibly exciting. In the meantime, the Center for Special Healthcare Needs is unique in and of itself, specifically in Delaware. So talk about the mission of the Center for Special Healthcare Needs and how someone watching can get in contact with you and your fellow caregivers there.
So what's really unique about the adult sickle cell program at the Center for Special Healthcare Needs is that we try to put everything that a patient would need in one place. So not just expert hematology care, but we also have primary care physicians who often see patients at the same time as I do. We have a social worker, a nurse navigator, access to behavioral health and physical therapy, and all those other services that are so important in helping keep patients healthy. And so if you or someone you love is looking for a home for patients with sickle cell, please call us at 302-320-6300, option 5, or look us up on the ChristianaCare website. We would love to have you be part of our family.
Dr. Guarino, thank you so much for the information today. And if you're watching and need more information on our sickle cell program, as she mentioned, ChristianaCare.org. Thanks so much.
Thank you.